pop this chair out of the way. And we're literally just going to be here just for like a minute or so. And so, I'll keep my sandals on for now. So we're just popping down. We're just going to be down here. I'm going to have my feet straight ahead. And I'm keeping my chest nice and tall. And now this might be really, really tough for you. And if it is, the first place I would say to modify this is to sneak something underneath your heels. Maybe it's a rolled towel, maybe it's a couple weight plates, something that can give you a false ability to dorsiflex your ankles. Because if you have really stiff ankles and you're doing this, you're probably going to find yourself in this position because you can't bring your knee forward to keep your chest up and stay balanced, okay? So if you have stiff ankles, it's going to push your butt way, way, way back, and then you're going to tip forward to help balance yourself. And that can put stress on your lumbar spine. It can not allow you to open up your thoracic spine during this squat, something that if you can't do, or if you have a stiff thoracic spine, you'll also bend over. So something that you might want to work on there. And weeks ago, I gave people the homework to pop down and see if they couldn't stay down here for 5 minutes, even 10 minutes. See what starts aching, see what says, hey, I need a little bit of love here. Because like I said, it's a pretty good assessment as far as mobility goes in your hips, in your knees, if you have a tightness in your knee or some pain in the front of your knee. And in the back of the hip, you might feel like you can't sit down nice and low. And like I said, that great place to start is just sneaking something underneath your heels and see how it changes your squat. I put a video up a little while ago about what that might do and how that can help you maybe work on prying yourself open through your chest, maybe prying your hips open side to side, things that can help you move nicely through your hips, and then your back, your ankles and things can start to fall into place and start to improve. All right, so I posted something earlier today, like I said, about the hips being able to rotate, and I put a couple hip switch variations in there, and we're going to actually start with one of those today. If you haven't checked it out, I wrote a little blurb about why hip rotation is important to produce power, but also with all the planes of movement. If we can't rotate our hips, we're not going to be able to squat really well. We're not going to be able to cut side to side and transfer weight and change directions very nicely with anything athletic. So we're going to scoot back here. I'm going to put my butt down on the mat. And the first variation I had a video of was with my arms behind me, and we're just going to do that one because what it does is opens up your hip a little bit, puts you in a little bit more extension or less flexion, we'll say, and that's going to allow you to switch your hips side to side a little bit easier. And so we're just going to do 8 of these, and then we're going to take our hands away if you can. Okay, so we'll progress it a little bit, and you might notice that your butt starts to scoot forward, and that's cool. If you need to adjust, you just adjust. But what we're doing is going through a reciprocal pattern here where one of my legs is going through internal rotation and one is going through external rotation. And this is something like a golf swing will take us through. And then we go the other way. And so we're looking at hip internal and external rotation. And so what you might see is with this, you might say, oh man, I can't get very far on my internal rotation on one side compared to the other. And you start to say, okay, I have a limitation in my internal rotation here. Is it because of some tightness in the back of my hip? Is it maybe a buildup of tissue in the front of my hip because I have an impingement syndrome? Maybe. That's something that you need to talk to your healthcare professional about. A little bit past the scope of these videos that we're doing here. All right, that's got to be 8. And so what I'm going to do is I'm going to scoot back a little bit. Actually take my sandals off. All right, and so now, if you can, I want you to sit up nice and tall. You're going to bend your hips a little bit more. We're going to take our hands away. So you're dropping your knees down. Same thing, hip internal and external rotation. Internal and external rotation. This requires a little bit more trunk stability, so it's a little bit harder. Okay, it's a little bit of a progression where it requires a little bit more motor control, a little bit more coordination. Roughly the same amount of mobility and stability. And I'm going to start rocking towards you guys. Yeah, we got 2 more on each side. And then we're going to turn this mobilization, or this little drill here, into a stretch for the backs of our hips. So we use that, and you can do this stretch before, you can do it after. You kind of use your muscles, warm them up a little bit. But we're going to go into that 90-90 position. Smooth these out, keep the aesthetic going here. So you're in that 90-90 position. We got about 90-degree bend in your knee, 90 degrees between your thighs and 90 degrees your other knee. Now, if this is really tough, maybe it bothers your knee to be in this position, you can use a yoga block or a towel underneath your knee. For this other knee, if you need to, maybe straighten it out a little bit. It might make it a little bit more comfortable if it's uncomfortable. But from here, I'm going to turn, and I'm going to actually just start rotating towards about, we call it my front knee. So this is my right knee. I'm going to turn towards the right, stretching out the back of my right hip. I'm just going to be here for a minute. I want to keep my chest up, okay? I don't want to go down into this flexed position. I don't want to put too much lumbar, passive lumbar flexion into my spine right now. I do enough of it with sitting through my day, so I want to feed a little bit of extension. It's also going to allow me to get a bit of a better stretch through my piriformis, my glute medius, the stuff on the back of this hip that we're trying to stretch. If you can rotate more and more and more, be my guest, but you want to keep your chest up and you want to feel that stretch in the back of your hip. And those external rotators of our hip, if they get tight, they can limit the amount of internal rotation that we have in that hip. And if you're lacking internal rotation, you're going to have some difficulty with squatting. You're also more likely, based on research, to have low back pain. It seems to be an indicator of people who are going to experience low back pain with activity is those people who are reduced in their internal rotation. So we're looking to have roughly, I think, about 45 degrees of internal rotation, if I can recall. I know that with golfers, we're looking to have about 60 degrees of internal rotation to be able to produce good backswings and follow-throughs without any compensations. So I'm going the other way, and I'm already filthy here. I probably should have worn gray everything or brown everything because I'm covered in dirt already. That's what I get for doing these at home. And then we're going to switch this. We're going to scoot back a little bit, and we're going to continue to stretch out these piriformis muscles. And I'm going to do this one seated with my back against the wall. If you have a chair, you can do it with the chair. If you don't, you can just do another pigeon stretch just to continue stretching out the back of the hip. We're going to be doing a lot of glute work, a lot of piriformis and hip stability stuff later. So I'm just going to stretch it out, get as much movement, as much range of motion as possible, so we can then use it and start to reinforce all of the gained range of motion through, with control, I should say, through range of motion, allowing for better hip internal and external rotation. But it is lower body day, so today's not just about the hips. We're also going to be doing stuff that's going to make our backs feel better, and it's going to stretch out we're going to do some hip flexor and quad stretching, all stuff that's going to make our lower bodies feel better. Okay, cool. I'm going to scoot my butt back. I'm going to sit up nice and tall against the wall and hope no spiders crawl down onto my face while I film this. So from here, I'm going to cross my ankle over my knee, and I'm going to pull in and just stretch out the back of my hip. Here comes Frankie. Frankie the bulldog, Frankie Tater Scott. Oh, that's right, you should stay right there, Frankie. And so we're still just stretching out the backs of our hips. If this is uncomfortable around your knee for whatever reason, we have a ton of regressions or a ton of lateralizations, other options to stretch out your piriformis. We just did one. You can go back and do that, or you can do a pigeon pose. You can do just a straightforward piriformis stretch. Hey, Frankie. Oh, you're all excited, huh? She's been great with the addition of our daughter to the family. She's such a sweetheart. Yeah, does my foot smell good? Just went for a run about an hour ago. Whoop! Frankie, there you go. Okay, and now we're going to switch sides. So you're just going to put that foot down. Maybe you need to move that other knee away. You get a little bit of a stretch. I get a little less stretch on this side. We're all built a little bit different too. So you might feel more stretch on one side, more on the other. I know that my left hip functions a little bit better. It's a little stronger, has more control. I have some previous injuries in my right ankle that probably lead my glute to be a little bit changed in the way that the motor control patterns work there. So I myself have a previous injury history, and it shows up in the way I move, and that's okay. I work within my limits, and I always try to progress it. We've got about 10 seconds left, 20 seconds left, somewhere around there. And then we are going to be doing some banded hip flexion. We're gonna start using the fronts of our hips, those muscles that go from our thigh bones through our abdomen to our lumbar spine. They help stabilize the spine a little bit, but they do function mostly as hip flexors. And if they are weak, there can be a little bit of an association with maybe a little bit of low back pain. But it is going to be a great opportunity to produce some trunk stability while moving the leg. So it is more of a core abdominal exercise, that kind of thing. Oh, Frankie, I know you're going to try to crawl all over me for this one. All right. Excuse me. Excuse me. Hi. All right. So I asked you guys to grab a looped rubber band. If you don't have it, you don't need it. But providing a little bit of resistance is going to help strengthen up your hip flexors, something that a lot of us don't think to do. We're all about, you know, your hip abductors on the side of your hip, your extenders with deadlifts, kettlebell swings, squatting, all that stuff. But very rarely do we work on the front portion of our hip. And it's just like any other muscle. It kind of falls into the same category as the neck muscles. A lot of people, for some reason, they train everything else in their body, but they're really hesitant to strengthen the muscles of their neck, even though it would provide them usually with a lot of relief. So these might actually lead to less tightness in the front of your hip, and this is something where you might do a hip flexor stretch before, do these, and then do your hip flexor stretch after and see how it's improved, see if it feels better. So you're going to be with the rubber band on your feet. You're going to try to get your bulldog off your mat if you've got one. Whoop. You're going to lay down. Excuse me, Frankie. And you're just going to pull your knee up towards your chest, and then it's going to go back down. And you have to get your knee above your hip level to get the most recruitment of your psoas. And so we're trying to get your knee past your hip joint. And we're going to make 10 on each side. You don't want to fly through these. You just want nice control. You want to be braced in your stomach, okay? You don't want to be flattened against the ground. You don't want to be sucked in. You just want to be ready for someone to drop a bowling ball on your stomach, okay? And you're not going to do that by flattening. You're not going to do it by sucking in. Just making a big barrel around your abdomen. And I got 4 more on each side. And then we're going to do a little bit more of a dynamic stretch for our hip flexors and our quadratus to help us with a little bit of that low back pain, or maybe a little bit of stiffness, inflexibility in our hips, whatever you want to say, that we gain through sitting all day. And we got 1 more to go. Okay. So we're going to be doing a step back lunge to a side bend. Keep that close by because we're coming back to that. So the step back lunge, you're coming back here, similar to a hip flexor stretch position. You plant your toes in back. We're working on big toe mobility there, which is great for the kinematics of the entire lower body back and all the way up the spine. You're not going to arch your back. You're going to maintain this big pillar from your knee to your shoulder, okay, as you step back. So it's going to be important that your abdominal muscles fire so you don't have that extension in your spine. From here, you're then going to side bend away from the down knee, and then you're coming up. So from the front, it looks like step back, side bend here. We're going to be stretching your lat, tricep, and quadratus lumborum. And then we're coming up, and we're only making 5 on each side, so I'm going to finish the last 3 on this side here. 1. Even working on a little bit of lower body stability and strength through the hip and quad with the step back. 2. And we got 1 more to go. And 3. And you might feel a big stretch through your hip flexor, maybe even the front of your abdomen, maybe even slightly above your belt line. That's all great. That's your hip flexor and your quadratus lumborum getting stretched out. And we'll go the other way. So we got 5 to go on each side. 1. 2. And you want to just try to have the most control over your working leg as possible. Also remember to go down onto those toes. 3. More control of your knee is actually going to be a sign that your hip is actually working nicely to provide some control. And we got 1 more to go. I actually don't even know what's up next on the menu. Okay, so what do we got? All right, so we're going to be doing some quadruped hip airplanes. So this is going to be a trunk stability, glute, and even core stability, maybe even a little bit of thoracic spine mobility with this one. We're going to be progressing it to a regular hip airplane by the end, which is great for balance and motor control of the hip. And then we're going to put it all together for a single leg deadlift to finish up with. But the quadruped hip airplane is just done on your hands and knees, and it's like kind of a half bird dog, where a bird dog is one arm, one leg. All we're doing is one leg. I've got my up hip that I'm going to drop down towards the ground, and I'm going to open up. So it's requiring my stance leg, I'll do it on this side, it's requiring my stance hip to fire, my glute to fire, to lift up. I'm getting a little bit of rotation through my spine, but I'm having to control my hip up and down. I'm not flying through it. So I'm creating internal and external rotation, abduction and adduction with my hip. I'm using the ranges of motion that we were stretching before to help ingrain maybe some improved motor patterning, improved control through those joints. And here it's all about your hip. We're not using our ankle really. There's a little bit of trunk stability, I said. We got 2 more to go. And then I'm going to switch sides. You can take one hand away, make it like a bird dog. Makes it a little harder on your trunk. I'll do that on this side too. But you can have both hands down, not a problem. You're trying to get stability in your trunk. All the movement is in your stance hip. I got 3 more to go, making 8 total on each side. And even this up leg has my glute working. I'm not just kind of here letting it go by. I'm really engaged through that glute, getting some extension through the hip, which we just worked on with those step backs. Okay, so like I said, we're going to progress this now, kind of like we did with the hip switches, from an easier version to a slightly hard one. Now, if you can't maintain your balance, or for some reason this is a little hard or it hurts, go back to what fits. Come back down to the quadruped hip airplanes, but we're going to do, everybody else is going to do regular hip airplanes, where we're in a slight bend in our hips and our knees, hips and knees, there we go. And our leg back, and we're going to make that same internal rotation, external rotation, abduction and adduction of the hip. You're going to make 8 on each side. If you need to reset and put your foot down to get your balance, cool, why not? Make it yours, okay? There's no rush to get through these. You want to be in a hurry to do them right. And so we're mobilizing the posterior structures of your hip, but we're also stabilizing with the muscles of your hip as well. And there's always this fine coordination of mobility and stability happening at the same time with the same muscles. There's not this one set of muscles that only does stability, and this one set of muscles that only does stabilization. All muscles are kind of on a spectrum as far as how much they're stabilizing and how much they're moving, and that's just how it is. And there's not a lot of science behind the fact that some people say there's only stabilizers and there's only prime movers. It just doesn't exist. And I got 1 more, and then I'm switching sides. Whew. Okay, maybe if it helps you connect a little bit better, put your hands on your hips, and you'll be able to feel all that movement occurring. There we go. Or if you need, I can put my hand on the wall back here to help with my balance. If you don't want to make it a balance exercise, although I do feel like if you incorporate some balance, you'll work a little bit more on your motor control and your ability to ingrain that pattern into your nervous system, and then remember it better without having to think about it. And so you're maintaining a slight bend in your knee and a nice bend in your hip, almost like you're setting up for a deadlift. There we go. I got to use the wall. 6. We got 2 more left. is it today? Tuesday, and I hope everybody's having a good week so far. I'm trying to learn how to function on about 5 hours of sleep a day, but I wouldn't trade it for anything. Some of you might know, most of you might know that I just became a dad about a week ago, and it's been awesome. My little daughter is the cutest thing in the world. I basically, any moment I have, I'm just staring at her, watching her, watching her breathe, just being, and it's beautiful. I wouldn't trade those couple extra hours of sleep for that. So fortunately, I'm fortunate where I can be home and help out, and just spend some time with her. So it's pretty awesome. All right, so we've done a little bit of stability control stuff for our hips. We're going to do a little bit of endurance work to make those muscles kind of fatigue a little bit more, so we can work on the ability to have some endurance in those, because our hip muscles, they work all the time, okay? With most athletic endeavors, they're going to be working a lot, and if you're not using your glutes, I don't know what you're using, because there's a lot of stuff that will compensate for them, and that can lead to some issues, some overuse, and some muscles that don't like being used very much, particularly your piriformis, which sits on top of your sciatic nerve, and that goes down your leg, and it's like, do I have a herniated disc, or is it my sciatic nerve? I don't know. But we're going to use our bands. You're going to have your feet straight ahead, okay? I don't want your feet turned out. And because when you turn your hips out, you have this external rotation moment, your muscles are shortened, you're going to be able to produce less force with your hips if you have them externally rotated than if you have your feet straight ahead, okay? So the amount of torque you have to create in your hips is higher by having your feet straight ahead. Therefore, you're going to work a little bit more on strength. You're going to fatigue them faster. Therefore, build up your endurance more. So I have a very limited runway here, but we're going to do 20 steps in one direction, 20 steps in the other. So if I get like 4 steps one way, 4 steps the other, I'm going to do 5 laps. I'll probably just go for like 45 seconds or something like that. We've got our band. It's going around your ankles. If you want to put it around your knees, be my guest, okay? I'm not going to be too picky. It's going to be a little bit easier if you have them around your knees. Depends on your band too. But kind of use whatever you got. Stabilize your trunk, like someone's going to hit you right in the belly. A cheap shot, you're not ready for it, so you're going to get ready for this punch, or someone's dropping that bowling ball on your stomach. Feet stay straight ahead. And what I want you to see is, what are my shoulders doing? Am I rocking back and forth like this? Nope. Or am I nice and level through my shoulders? Because if I'm not level, if I'm going here, I'm actually shortening my glutes so much, it's probably going to turn off. And I'm going to push myself forward a little bit. I'm going to be using my low back muscles. I am going to use my glutes a little bit, but I'll also be using my quads. Those aren't things that I want to necessarily focus on with this. I want to use my glute medius to push myself in the direction I'm going. Okay, so this is a pushing movement. I'm using this leg to push myself that way, and then this way. Good. Feet are staying straight ahead. Not rocking my shoulders. Okay, that's not what we're doing. I call these crab walks because we're going sideways like a crab walks. Some people call these monster walks. Your choice. All right, I'm gonna go down and back twice more. That'll be about 20. My butt's screaming at me. Did a lot of pistol squats yesterday and then went on a nice 4-mile run today, so my legs are pretty smoked already. But I knew I had this coming. It's my little cool down, stretching, all that stuff. Selfishly, I'm doing this all for myself. Just kidding. Doing it to help all you guys feel a little bit better. Stay ahead in your hip, low back, knee, ankle, toe health, so you can feel good and continue to do what you're doing. All right, so we're gonna actually move the band up from our ankles if we haven't done so already with your crab walks. And we're gonna be doing a standing clamshell. Now, typically people are on their side for these. It's unweighted. You're using you're not fighting gravity with your spine, with your glutes. But now we're gonna be using our hip rotators while using our anti-gravity muscles, our soleus, our quads, and our glutes as well, to produce some external rotation of that hip. So you're going to go down in that same athletic position. Okay, knees are bent, hips are bent, but I'm up on my toes. This is my working leg. This is going to allow me to rotate a little bit easier, and I'm coming out and back in. And we're going to do 20. Because once again, we're working on the endurance of these muscles. If you wanted to work on the strength of these muscles, we'd be using a hell of a lot harder band or a lot more weight and doing way fewer reps, okay? There's a certain set and rep scheme that we use to go for certain movement characteristics. So if we're working on endurance, we do things lighter, more in like the 40% range of our 1 rep max for many more reps. If we're going for strength, we're trying to sit somewhere between 60 and 80%, maybe even 60 to 90% for much fewer reps. So we're talking 3 to 5. And I think I'm on like 10, 11. And we're also working on the stance and balance and stability of this non-working leg. Feeling this right in my glute, right in my butt cheek. Okay, we're switching sides. This might be a little bit easier for this leg. Like I said before, my left leg is a little bit stronger than my right, so I could probably do a lot of these. But that's okay. You get the gist of it. So here though, we're also showing that you're getting some rotation in your ankle. You're also getting a little rotation in your knee, which I talked about at the start of this, about how, even in my post today, I said if you don't, rotate your hips, you just have more knees. Well, guess what? The knees have to rotate too. So if you're actually lacking rotation in your knees, then I don't even know what you have. Okay? You have a problem is probably what's going to occur, because we need a little bit of rotation in our knees. We need a good amount of rotation in our ankles and our hips so we can turn, cut, and actually produce tons of force. So we need to be able to rotate. We need to be able to contract the glutes to produce lots of force with our legs for anybody who's throwing or rotating in their sport. So I think golf, baseball, quarterback, that kind of thing, field hockey, that stuff, volleyball. I think we got one more. Okay, and I built this little rest break in to get a hip flexor stretch before we finish up with a side plank and a single leg deadlift. So we're gonna just pop down onto one knee. You got your toes tucked under and back, big toe mobility, super important for ankle health, big toe health, reducing the chances of bunions, plantar fasciitis, improves your hip extension, that kind of stuff. So it is valuable. So you want to work on it wherever you can. I'm going to bend forward. I'm going to tuck my pelvis under and come up. And now this is a garbage stretch. Okay, here you're not getting much. If you're leaning back here to try to find a stretch instead, why don't you reach back, find your foot, and be nice and tall through your torso, through your knee, through your torso. Now if you can't reach your foot, cool. Drop it back down, work on that big toe mobility, get that hip flexor stretch. With this, you're going to get a little bit more quad. It's all good. It's a lower extremity day, lower body day. Working on maybe some mobility of that kneecap. Maybe you've been running a lot lately, doing a lot of squats. Your quads are barking at you, and this is what you need. I'm just going to be here for 1 minute. I got my watch behind me, so I can't really see, so I'll guess. But we're trying to get that heel all the way up to our butt if we can. If you need to be down here, and you want to get a little bit more stretch, you're going to shift your entire body forward, okay? You're not just going to push your hip forward, because that's going to create some compression, maybe a little bit of discomfort in your back. So your whole body goes forward to get that stretch, not just your hips. Where the rest of you can be up here. We're just hanging out. Taking a break from all that difficult stuff we were just doing. I broke another sweat today. It's all good. Try to sweat at least 5 times a week. They say sweat every day, but sometimes that's not realistic. Sometimes you need those rest days I talked about. Work on, meal prep or sleep or meditation or just something else that you enjoy that reduces the amount of stress in your life. All right, we're gonna switch. All right, so I'm going right into it. Quad stretch, nice and tall, not leaning back. If I'm here in this position, it's not worth it. Just bring your foot down, just relax. Because we're going to be doing some side planks that work on our hip extension and hip internal rotation. We haven't done a ton for our hip internal rotation since the beginning, so I figured we would sneak it back in here with a side plank. You might say, whoa, I didn't know that I could be that restricted in anything, and you'll see what I mean in a minute. But we know that for our back health, working on our obliques, our abdominals, our hip strength, our quadratus lumborum, all that stuff needs to be used. We need to use it, or it's going to be, going through disuse, atrophy. It's going to maybe be a little bit stiffer. Maybe it starts to bark at us. Because the more you use something, actually, it's going to probably reduce the amount of sensitivity you have to it, okay? Meaning that, you know, it's going to take more to create discomfort than if you continually use it. A lot of times the aches and pains we feel, it's just that. It's just muscles saying, hey, I want to move. I'm born to move. And we have these joints and this muscle and our motor cortex. It's all proof that we're supposed to explore our world and kind of run around and exercise and, you know, just move and use these bodies that we have. All right. So we're going to have another bulldog. We're going to have the bulldog, Frankie, join us for this probably. But we're going to drop down onto our side for a side plank. Hi, bud. Hi. Hi. And so you're going to be doing a short side plank. And what's going to happen is you're going to go up just like normal, okay? Maybe you just hold off for a second while I show you. So you're going to go up and you're going to start doing 15 hip internal rotations on your top hip. You're going to try to prevent your entire body from rotating, okay? So we're going up nice and long. We're using that extension that we just went over with our hip flexor stretch. You're going through hip internal rotation 15 times, and you're going to feel the muscle in the front of your hip here working, and that's okay. It's doing its job. Okay, we're using our TFL. And Frankie got bored. She wants to go take a nap. I think I got like 3 left. I'm really tall through my hip. You probably can't see because my shirt's sagging. 2, and 1 more. 3. Good. Okay, we're going to switch sides. Same thing, 15. Okay, so we're going up and pushing your hip forward. Okay, so we're getting some hip extension where you're squeezing your butt cheeks together. Knees are together. I'm working on going through hip internal rotation. Now, it looks like I'm a little bit more limited on this side. I actually feel my hamstrings working here. But we want to use that hip to get that internal rotation, reinforce all those hip switches that we did way at the beginning, all the prying squatting that we did at the beginning, rotational stretches, trying to reinforce all that stuff, all that internal rotation, because it is important. It's not just all about the pigeon pose and the back of the hip. We want to use our hip through internal rotation as well. And I don't know, 2 more. We just got single leg deadlifts, then we're done. We're going to go for 8 single leg deadlifts on each side, then we're all done. So for those of you who are new, little slight downgrade there. Okay, so for those of you that are new here, a regular deadlift, when you set up, your butt pushes back and your knees bend slightly, okay? So you'll see I have more of a bend in my hips than in my knees. So that's a regular deadlift setup. My back was nice and straight. I wasn't rounded, okay? We're reinforcing trunk stability with hip strengthening with these exercises, with these deadlifts. It's part of a hip hinging pattern, okay? Like this, like you're setting up for a golf swing. But what you're gonna do is you're gonna set up into your deadlift position. You're gonna shift your weight onto one leg and then take the other one away. Now this is your single leg deadlift position. From here, you stand up and then you get back to where you were. Your back leg is an extension of your spine and then you're up. So it's similar to that hip airplane position. And if you need a wall or a chair or a pole or a broomstick or whatever to hold on to, be my guest. This doesn't have to be a balance exercise, but once again, it's really nice to make it a balance exercise to add that little bit of control component to it. We're going to go for 5 more. And if you have dumbbells, a kettlebell, a bag of flour, a medicine ball, a big rock, whatever it is, you can load this up and start to work on your strength and control a little bit more. I got 2 left. 1. Really trying to just think about what is my butt cheek doing here? How hard is that working, okay? Or you can just work these into your warm-up as a nice little reminder of your balance and your ankle control, your trunk stability, and your hip mobility and control as well. And so now we got our last side. So down. The goal is not to touch the floor. The goal is always to do it as good as you can. If you start touching the floor, you're probably going to be rounding your back at some point. If I straighten my back from that position, you'll see how much my hand came away from the floor. So if maybe you have like some yoga blocks, that could be a good target for you. Maybe you have a kettlebell and you're just going down and touching the top of it. anything will work. Or you don't need a target, and you just have to make sure you say, okay, I'm going to keep my back straight for these. Back up a little bit. Now I got 2 left. I'm going to see if anybody had any questions or comments that I need to address. Okay. That was it. How do we do on time? That was a longer one. We got 40 minutes. That was pretty good. I feel good. All right. Let's see what everybody's got to say. All right. What is an indication if one side is weaker, harder to do on the other side? What is it? Well, it indicates that you probably need a little bit more strengthening. Maybe you have a previous injury in your ankle or your hip, or maybe even some back issues that can cause some atrophy on that side. And that last thing that we did, the single leg deadlift, is a great way to improve your side plank and vice versa. If you're having issues with your single leg deadlift, and for some reason you can't do the balancing, maybe the side plank allows you to squeeze your butt cheek a little bit. You can add rubber bands, and there's a ton of variations. You can make it longer by going on your foot to your shoulder, foot to your elbow, to make it a little bit harder and increase the amount of lateral hip stability or strength that you do have. So that can actually, those two can feed into each other pretty good, as well as the standing clamshell and the crab walks. All that stuff kind of fits together. The goals are the same for those. They're just different ways to go after the same what do you want to call it, training effect. There we go. So I'm going to